I do have a video on my phone. I was on a swing set, and I just felt that day like I was happy where I was at in my life. It was taken the day before the accident. My cousin and I went to have dinner, and we were just on our way home, and the accident happened. At some point, I blacked out, and the paramedics were already there and helping me.
There was pretty major damage to the vehicle. We could see a younger female sitting in the passenger seat.
As I approached her, I asked her how she was doing, and she said, "I'm fine." I looked into the vehicle and realized that Paula was not fine.
I remember kind of holding my arm because I could see like the skin and everything just, out.
She had some severe damage to her right arm. She apparently had her arm out the window, and it was crushed between the concrete jersey barrier and the side of the car.
I saw lots of blood on my clothes, and I saw a piece of bone just kind of sticking out.
They teach you in school how to splint a broken arm. They don't really teach you how to splint a crushed one.
My cousin covered my face and said not to look because it was pretty bad.
We, go above and beyond to make her, as comfortable as we could make her. Starting an IV, giving her pain meds while she's still in the car, because we knew that at the point we had to move her, we were gonna probably cause a little bit more pain. Time was the urgency for sure. From the time that we got the car door open to the time that we left the scene was approximately 6 minutes.
In the ambulance, there were 3 paramedics. There was one to my left, and I just remember telling him to keep me safe, that to not let me die.
She stayed calm. She stayed extremely respectful. We don't see that a whole lot. And so to get to see that from her was pretty awesome.
With trauma like this and the mechanism and the injuries, we took her to Parkland.
I did tell Parkland on the phone that this was going to be a level 1 trauma. So we get the full meal deal when we get there, and they were ready to go, ready to go to work when we arrived with Paula.
From the moment that a patient has a traumatic event, the first person that interacts with them starts the chain of events that will save their life or will cause a delay in their care. We have a team that consists of 10 to 15 people, and our goal is to get the patient in, worked up, and out of the trauma department as fast as possible so that they can go on to their next stage of care.
I was on call the night she came in, and we got her to the OR within probably an hour or two of her hitting the hospital doors. And it was a lot of surgery. It was pretty tedious. Probably 2-3 hours that we were in surgery the first night.
I felt like I was losing it, and my nurse kept letting me know that everything was gonna be all right, that's what she was there for, and it helped a lot.
We meet our patients on one of the worst days of their lives. They're just scared to death, and they don't know what to expect. And so we try to be there to explain what's gonna happen and making sure that they're as comfortable as we can make them.
Dr. Sathy spoke to me about how severe the injury was.
This was definitely a limb-threatening injury where there's possibility of losing the arm, but we just don't have the technology to recreate what the human hand can do with a prosthesis. So it's really, really important to try to save the patient's own hand if you can.
I wanted to get my movement back. I wanted to feel normal again. I lost most of my tendons, and I lost 2 to 3 nerves. So I had to go through a lot of physical therapy to regain that movement. It's really hard learning that, before you were able to do as simple as picking up a spoon and having some ice cream or cutting a steak. I didn't really pay attention to the way we did things, basically like taking it for granted, and it's a really hard feeling just having it taken away from you.
She's a trooper. She did everything we asked of her, and she came to all her visits and went to her therapy as prescribed, and she really put in the work.
She really motivated me to work hard because of how hard she always worked.
It really gives us the inspiration to, when life hands us something suboptimal, to, take it in stride and keep going.
September 16 was 3 years, and I've actually accomplished a lot of things. From going to therapy, pushing myself, and just realizing that we can't really take anything for granted.
I've been able to see Paula get back to her life, maybe not the life she thought she was going to be having, but she is back to work. She has good relationships, and she's really been fearless in her treatment. She's been willing to do almost anything, even though it was painful.
It's really nice to see people like that 1 or 2 years after their injury, because it's a long road for everybody involved, and to kind of see them at the end of that, it's really rewarding.
I think there's a lot of pride and satisfaction that you have to take out of a run like with Paula. And so it's a great joy for us.
Everybody here signed up to help people, and when you help somebody, especially somebody like Paula, it's awesome.
Thank you. Thank you for saving my life. Thank you for never leaving my side when it got difficult. And you guys rock.